everyone, Michele Crosmer here, and I am with Dr. Sean Hashmi, and welcome back to Plant-Based Kidney Health.
It's good to be back, Michele.
How are you doing?
Oh, I'm doing good. Listen, I wanted to give you and all of our audience an update. So I'm on week number 4 of my jiu-jitsu training, twice a week. And I train in the morning, so I do lifting in the morning, and then I go twice a week in the evening. But no injuries so far. I'm loving it. It is such a beautiful sport, but I also realize that I have to know my own limits. But I am really, really, really excited about this amazing thing called jiu-jitsu. It is the most fascinating thing. And the friendships you form in there, it's unlike anything else. There's just something about, you both go through pain together, and then at the end of it, you hug it out, and it's like you're best friends forever.
Well, we will have to have some sort of episode and special guest on to talk about jiu-jitsu, or maybe teach all of us some simple moves in the future.
Absolutely. Absolutely.
Oh, I love that. Okay, so today, you guys, we are talking more about potassium. If you have not checked out our previous episode, we talked about potassium and why it's so important for kidney health, what high potassium and low potassium looks like in the blood, and what that means, as well as how many milligrams of potassium someone with kidney disease might need in a day, whether it's low potassium, moderate, or high potassium. So make sure to check out that episode. And then today we're diving more into potassium. There's so many questions around it. So let's get started right away. And I think this is something that I always like to talk about, because as a renal dietitian, it's almost like offensive that everything is blamed on food and everything's blamed on diet. So when it comes to potassium, what medications can impact potassium levels, both like high or low, and what other just like conditions or things going on could potentially impact blood potassium levels?
All right. So here's where it gets really, really interesting. High potassium is actually not because of the food you eat. Now, this is going to be like, oh my God, wait, what are you saying? My doctor tells me, eat low potassium diet. My dietitian says, so that makes no sense. Well, give me a second. Hear me out on the logic behind this. The reason people get high potassium is for 2 simple reasons. First is because of the fact that potassium that's inside their cells moves from inside their cells to outside. So if you remember the last episode, we talked about the fact that 98% of your potassium is inside the cells, right? And outside of the cells is only about 1 to 2%. So in other words, very little is there. So imagine if just a little bit of shifting occurs, that can be enough to cause a fatal heart rhythm. The second reason people get high potassium is because they can't get rid of it. So in other words, normally, if you do not have kidney disease, what do you put in? So let's say that I go and decide to have potatoes or a banana or avocados, whatever it is. I have that, and you wonder, why did my potassium not go up? It's because my kidneys got rid of the excess. So the problem there is if the kidneys can't get rid of the excess, or if they're shifting from inside the cells to outside. So remember, high potassium in somebody who has normal kidney function is extremely rare. And when it does occur, it's usually because what? It's shifting from inside the cells to outside. So in terms of the causes of high potassium, let's talk about the shifting. That's inside the cells to outside. So in last episode we talked about a type of acidosis we call metabolic acidosis. It's basically acid building up in the blood that drives potassium to go from inside the cells outside of the cells. Another thing that's really important is insulin deficiency. So if you don't have enough insulin in your body, that will cause potassium to rise. Now, why should you care? Because let's say you're somebody on dialysis, or let's say you have a late stage chronic kidney disease, let's say stage 4, stage 5. And you go and look at Dr. Google, or worse yet, you go to YouTube and watch some guy saying, you know what, if you just fast, you're going to go ahead and lose all this weight. And you fast, and next thing you know, your potassium is through the roof. So if you have chronic kidney disease and you can't get rid of that potassium and you do prolonged fasting, the fasting will have low amounts of insulin. With low amounts of insulin, you'll have higher potassium. Now, fasting is wonderful, and we'll have episodes where we talk about different types of fasting and how you can do it safely. But if you have chronic kidney disease, realize that insulin deficiency can raise your potassium. Another thing is what if you just have tissues that are breaking down? So in other words, God forbid you get into a car accident. There's crush injuries where the muscle break down. So remember, intracellular or potassium inside the cell is very high. So 98% is sitting there. You crush it, the cells break apart, and you release it. So next thing you know, you can have all this potassium, and that can be dangerous going on. In terms of some basic stuff like medications and stuff going on, certain things, for example, like beta blockers. Beta blockers, especially the ones that are non-selective. Now, that's just a fancy medical name, but those are like propranolol or labetalol. So if you're on propranolol or labetalol, those can actually increase potassium, because what they will do is they will actually prevent the potassium from outside your cells from moving into your cells. So those are medications. Exercise, now here's where it gets really interesting. So yeah, exercise will raise it, but that's nothing to be alarmed. If you remember the last episode, one of the things we talked about was clenching. If you clench your fist a lot when they were drawing your blood, you can actually raise your potassium by 1 milliequivalent. So remember, if you look at the range of 3.5 to 5, 1 milliequivalent could raise it to 6. And all of a sudden, everybody's alarming because your potassium is so high and they want to know. And then the last thing is there's actually a rare disorder that's called hyperkalemic periodic paralysis. It's autosomal dominant, extremely, extremely rare. And basically what happens is if you're out in the cold weather, if you exercise, if you fast, or even if you just ingested some food with potassium, you get massively high levels of potassium going on, even though your total body potassium is normal. So those are all the causes for what causes shifting from inside to outside of the cell. Now let's get into the second part of it. And the second part is remember we said there's two causes of high potassium. One is the shifting, but the second is what? It's reduced clearance, or in other words, your kidneys are not getting rid of them enough. So remember, we don't think about it as what you eat. We think about it is what you eat, can your kidneys keep up with it and get rid of it? If they can't, potassium will rise. So common medications are things like NSAIDs, Motrin, ibuprofen, Aleve, etc., and all those guys, right? It's calcineurin inhibitors like cyclosporin, tacrolimus. What are those medications? If you have a kidney transplant, you will be on one or the other, cyclosporin or tacrolimus. We also use that for a number of conditions, including autoimmune kidney conditions going on. Another condition that happens in diabetics a lot is hyporeninemic hypoaldosteronism. Fancy word. You got to spell it like crazy to figure out how to spell it, but it's basically because you have low plasma renin activity. And as you have low plasma renin activity, there's an entire cascade whose job it is to hold on to salt in the body and get rid of potassium. Low renin, you're not getting rid of potassium through the kidneys. Heparin, which is very, very common. It's used in dialysis machine, it's used everywhere. Heparin can raise your potassium. But the most common medications for kidney patients are your angiotensin inhibitors. What are they? They're your ACE inhibitors or ARBs, lisinopril, losartan, benazepril, all of the artans or prils. If they have those endings, those are either ACE inhibitors or what we call ARB. There's also diuretics. Now, diuretics are designed to make you pee, but there are certain diuretics whose job it is to hold on to potassium. So, for example, if you're on amiloride or triumtrine, both of these diuretics will try to spare potassium from leaving the body. And then the last thing is specifically aldosterone antagonists. What are they? Spironolactone, eplerenone. So the take home from this very complicated answer is two things. It's either because potassium shifts or because you can't get rid of it because your kidney number is low. And if you can't get rid of it, our next best thing is to either change the medications you're on and or to reduce what goes in.
Perfect. That's a really, really perfect explanation. And since you brought up that second part of if you can't get rid of it, can you just then briefly explain how do we get rid of or excrete potassium? And how much of it is kind of in those different those different methods?
Yeah, so there's many ways to treat high potassium. The first thing you have to know, and I have to tell you, on my Instagram page and my Facebook account, I got a couple of messages from a couple of people who said, their potassiums are 6 and they don't know what to do. Anytime it's higher than 5.5, you have to know this, please. It is considered a very critical value. The risk of a fatal means you can die from this. A fatal arrhythmia rises above 5.5 and continues to go up. Certainly, if you're above 6.5, we have to do something. That is a critical emergency. So let's talk about critical potassium levels. And what do we do? So if your potassium is critically high, meaning it's 6.5 or above, the first thing we do is we have to deal with the acute situation. So acutely, we can't get it out. What we have to do is shift it into cells. The best thing to do is first stabilize the heart membrane so that you don't get an arrhythmia. And how do we do that? We immediately inject IV calcium. That's the first thing. It's very quick, takes less than 15 minutes to work, but here's the downside. It only buys me about 30 minutes to 60 minutes. Now, that's enough time for me to do the other stuff. But that's the first thing, especially if the potassium is greater than 6.5. And if you're listening to this, please do not ignore high potassiums. Even if you're running in the low 5s, we want to do something about it because it can be very dangerous if it gets higher. The other thing we do is, remember, insulin deficiency causes high potassium. So what do? We give you insulin. And we give you glucose with it because we don't want your sugars to crash. But immediately, we'll also give you IV insulin because it can lower potassium by as much as 1 point. So if you're 6.5, it could take it down to 5.5, theoretically. And then the third thing...
Are both of those done in a... Like someone has that's a critical value, your doctor's calling you and telling you to go to the hospital?
Yeah.
Or is that done in like a clinic? Okay.
No, so if you have that, greater than 6, we'll tell you it's urgent care or emergency room. And the reason is because the insulin and the calcium will not last. So because they're not going to last, this is all temporizing to protect you from that fatal arrhythmia that will cause your heart to stop. Now, the third thing that we don't do as much anymore is because people can have all sorts of issues, especially our kidney disease patients, is in the past, we used to give them a beta agonist, like albuterol. So remember albuterol you use for asthma and stuff like that? The problem is it causes your heart to race. And a lot of our patients who have kidney disease, if you remember the statistic that I gave you guys, which was that the chances of people actually having a heart attack when they have chronic kidney disease is greater than them going all the way over to dialysis. How crazy of a statistic is that when it comes to heart disease? So therefore, we're worried about speeding up your heart, and that's why we try not to use beta agonists. But that's all of the acute stuff. So now I have stabilized your heart, and that's emergency. Next, we're going to talk about how do we go from just the shifting portion to actually getting rid of the potassium, which happens in chronic patients, meaning if you just run higher, this is what I would do, or in emergencies too. So the fastest way, of course, to get rid of potassium is we dialyze you. And we do that in emergency cases all the time. But while I'm getting my machine ready, I'm putting in the line, or I'm having my vascular surgeon help me put in the line, whatever the thing is we need time. And that's why these three things that we talked about, which is the calcium, the insulin, and the beta agonist, are so important. But we only use calcium and insulin nowadays. Now, to remove the potassium, if you have good kidney function, something that works over time, that works great, is diuretics. We can make you have more urine come out that actually has more potassium spillage. So remember, there's potassium-sparing diuretics. We're not going to use those. We're going to use loop diuretics like Lasix, or thiazide diuretics, the most common one, which is hydrochlorothiazide. So that's one. In some patients, especially if they have some acidosis going on, we'll even give them sodium bicarbonate. Now, sodium bicarbonate, we can have them on it chronically, or in an emergency situation, we can give it as an infusion, but it takes like 4 to 6 hours to work. And if somebody's potassium is higher than 6.5, if you don't act right away, it can be fatal. So sodium bicarbonate is not something we do as an emergency thing, but we can, especially if I need to buy more time. But the hallmark here is what we call the potassium exchangers. It's a fancy way of saying is these are things in your gut. They will bind the potassium and they will help you to, when you go to the bathroom, they'll get rid of it. So there's really three that we have. And this is no particular order. But the first one is sodium polystyrene sulfonate. That is the classic, right? Don't worry about that name because nobody can say the name. It's Kexalate. So if you've heard the name Kexalate, that's the oldest one we have. Then we have a couple of new kids on the block. Patiromer, which is Veltassa, is a new one. And zirconium cyclosilicate is another one, which is Lokelma. So you got Lokelma, you got Veltassa, and you got Kexalate. Now, which one should you use? This is the $1,000,000 question. So I'll tell you, before we had Lokelma and Veltassa, we didn't have a choice. We used Kexalate. But I don't like Kexalate. And I don't like it for a couple of very important reasons. First, even though the risk is very small, there is a risk for bowel necrosis with Kexalate. Number two is of all three of them, it is probably the one that's the least tolerated when it comes to GI side effect. The bloating, the pains that happen, the nausea that you get from it, and of course the diarrhea. But because of those reasons, we really like to use other things. For example, Lokelma. Lokelma happens to be my go-to both on the inpatient side and on the outpatient side. Now, one thing you got to remember with all of these binders, specifically Veltassa and Kexalate, please listen to your doctor and listen to your pharmacist when we tell you don't take any of your medications either right before or right after. Oftentimes we'll tell you it's 2 hours to 4 hours that we don't want you to take any meds before or after because both Veltassa and Kexalate will bind to them. And as they bind to them, they will prevent those medicines from going in, and that could be a really big deal. Whew, that is a difficult question to answer. Wow.
No, and that's super helpful. And I think it just shows, and everything you've said so far reinforces the why high potassium occurs, and then obviously how we treat it. And I mean, the good thing is there's multiple different methods of it, but ideally if we can prevent, potassium levels from becoming elevated like that, especially in an emergency situation, that's best. But at least we know if it is that elevated, then it can be treated. So it is something, make sure. And again, you likely are going to get a phone call from pretty urgently from your doctor if your levels are that elevated and they're either having you go to, like you said, the ER, the urgent care, or they're starting you on some sort of medication to help kind of chronically if you're struggling with those higher potassium blood levels.
Yeah. So Michele, let's get into some specifics here because now that people know the why it's so critical, now let's talk about what and how. So what plant-based foods are lower in potassium? And especially, we're talking about people who are really trying to follow more of a plant-based diet. And I'm sure you get asked this question all the time, which is, how do I get a lower potassium and do a plant-based diet? The other part of this is how do people include higher potassium foods in their diet, especially if they're told, something different as in, you have to restrict your potassium. And the kicker for me always is we give blanket statements without checking their blood levels. And a lot of times you can have some food, but not have to worry as much. But let's talk some specifics.
Yeah. And that's so important because again, we always want to reinforce that it's individualized, it's based on you and your lab work and maybe medications that you're on that might be raising your blood potassium levels as well. But ultimately, and if you remember from last episode, we talked about a low potassium diet doesn't mean no potassium. Usually low potassium is around 2,000 milligrams of potassium a day. And so if we look at plant foods that are lower in potassium, if we go kind of group by group for our vegetables, a lot of leafy greens can be lower in potassium. So arugula, curly kale, collard greens, even like romaine lettuce are all lower potassium greens. Cabbage is a great lower potassium vegetable, cucumber, jicama, green beans, onions, bell peppers, garlic. So there's still a lot of, and those are all the like lower potassium ones. There's tons of moderate potassium ones that could still fit into a low potassium diet in smaller portions, but we'll stick with talking about kind of the lower ones. Fruit wise, berries are going to be lower potassium, and also they're high in antioxidants, they're high in fiber, but specifically blueberries are, of all the berries, those are the lowest in potassium. Apples are good, pineapple, cranberry. So lots of options for fruit. When we look at whole grains, I think that's one of the things too. It always comes up, oh, I can't eat whole grains because it's too high in potassium. Even, yes, whole grains compared to a highly refined white grain is going to have more potassium, but it's not this drastically larger amount. So things like brown rice and wild rice both of those are not high in potassium. They're lower or low to moderate. Barley, farro, millet, those are all lower potassium whole grains. If we look at legumes are the tricky one, right? Some are very, very high in potassium, but chickpeas or garbanzo beans are lower potassium. Green peas are lower potassium. Tofu is lower in potassium. And the other thing too is, and I was just talking about this and how to post on it today, but pumfu, I don't know if you've ever heard about it, but it's like a tofu block, but it's made out of pumpkin seeds. And so it's a soy-free option, and it looks funky, of course, because it's kind of in this like, it looks like a block of tofu, but it's round. But because of how it's made of like cooking the pumpkin seeds and then pressing all of the water out so that it forms this solid block, a lot of the potassium is removed in that process. So it actually becomes low in potassium. And you can find that online, or Whole Foods, I'd say, are probably the easiest places to find that. From nuts and seeds, very commonly, those are on those lists of like high potassium, you need to avoid this. So walnuts, pecans, and macadamia nuts are all lower potassium nuts. And then both chia seeds and flax seeds are lower potassium seeds compared to other seeds. And I think that covers all the different, kind of plant groups of things. But so again, if someone's on a lower potassium diet and they are looking to, again, we always want people, especially with kidney disease, to be getting more fruits and vegetables in. So then majority of the time you're wanting to consume those lower potassium options that I just mentioned, because then you can eat them in larger volumes. That doesn't mean that you can never, ever, ever eat your favorite food like a banana if you are in a potassium restriction. It just comes down to that portion and the frequency, because those foods can add up much more quickly. So to put that in comparison, like let's say you just love bananas. Bananas are a high potassium fruit. So a half of a banana is about the same amount of potassium as 2 cups of blueberries. So when we look at volume wise, like yes, if you choose the blueberries and you have 2 cups and you get a lot more fiber, you get to eat more of it. It's probably going to be more filling and satisfying, but it doesn't mean that's what you have to choose. If you're like, hey, a banana sounds good, I want half of a banana in my smoothie or my oatmeal or as my snack instead of this other fruit option, then limit the portion so that you're not overdoing it. And I think usually where people get into trouble when they need a low potassium diet is they're not realizing that they're having such large portions of a lot of different high potassium foods. So they're having like an entire avocado on their meal instead of a quarter avocado, or they're having, a cup of tomatoes mixed into their salad versus, someone has a slice or 2 of tomatoes on a sandwich. That's not going to be high potassium. So it really comes down to that portion and the frequency. And then in general, to consume a larger volume of these plant foods that we want people eating, then it's choosing the lower potassium option. So that way they can eat, still be eating in abundance and be getting, be full and satisfied and be getting enough fiber in their diet.
No, that makes so much sense. And I got to tell you, Michele, every time you speak, it's like, oh my God, there's so many names of foods and fruits. And I heard like curly kale. Oh my, I've never heard.
It's the curly kale is like the common kale that you see in the store. So it's low compared to like dinosaur kale is the one that like, it's kind of like green and purple and it's like longer. But dinosaur kale is a little bit higher in potassium than curly kale. I mean, ultimately that's the thing too. I mean, when we just talk about like how awesome a plant-based diet is and how much variety there is. Like you think of cauliflower, right? Cauliflower is a moderate potassium vegetable. I mean, there's like purple cauliflower, there's green, there's white, there's orange, there's an abundance of all of these different options, and there's low potassium, moderate potassium, high potassium. And so that's where there's so much room for diversity and flexibility and variety. It ultimately comes down to that, knowing your potassium needs and then choosing those foods and the portions that will fill up your plate, make it colorful, and then fit those potassium needs.
Yeah, that's awesome. And, things that you mentioned, for example, flax seeds and chia seeds, constipation is such an issue with CKD and dialysis. And that's all of the binders, in order for them to work, all of those resins that we talked about, if you don't go to the bathroom, all that's going to happen is, yes, you pull the potassium out, and then slowly, the potassium goes back in. So incorporating foods that help you to have a regular bowel regimen, and that includes exercise and movement and so forth, it's so important.
Yeah. And I think that's something too and this was a question that we did get asked, and it kind of, comes into this with constipation, is that like, is potassium absorbed differently, from plant foods or from animal foods? And unfortunately, there's not enough research on that. Like we know with phosphorus, we know the absorption rates, and we know plant phosphorus is absorbed less than animal phosphorus, but we don't have that for potassium. But what we do know, like you said, is that, through your bowel movements or through like the feces, that's one way of excreting, getting rid of potassium. And if you are constipated, or you have irregular bowel movements, or you're not going every day, or you have a slow transit time, like it's kind of like that stool is sitting in your colon for longer, or you don't complete your bowel movement, all of those things can increase it just makes it so there's more time for more potassium to be absorbed. And so sometimes we see that too, where yes, if there's a piece of, because again, meat, dairy, eggs, fish, seafood, chicken, like they all contain potassium as well. So we always like make plant foods the villain, but animal products, excuse me, they contain potassium too. And so but they don't contain the fiber, and the fiber is what is helping to promote those regular bowel movements and increasing the transit time. So for lack of a better term, your poop's not just kind of sitting there, and more potassium is being absorbed. So it's just another reason why, hopefully we get more and more research coming out on this, but why the fiber is so beneficial and those regular bowel movements, because it potentially can impact potassium levels as well.
Well, that's fantastic. I think we got the questions in for this episode.
Yeah, I did have actually one more that someone had asked, and I'm not sure I guess let me know if you can answer this, but it was more on a different like blood potassium test. Like instead of like serum potassium, they called it like an RBC potassium. Yeah, so I think that's testing like the intracellular potassium, and they were asking like, what's better? Should you have both tested?
No, so the answer is you don't need the blood potassium. Remember, serum, and this is important because people confuse serum and plasma. So serum is the liquid that remains after the blood has clotted. So I draw your blood, the blood clots off on the bottom, and what's left over, that's considered serum. Now, plasma is the liquid that remains when I prevent the clotting from occurring on the bottom. So when the clotting can occur, I put an anticoagulant or whatever, what that liquidy portion is that's plasma. So serum potassium is what we go ahead and measure all the time. And the reason that matters in terms of serum potassium and plasma potassium is when we look at this stuff is plasma potassium. If you get that measurement, that's going to be about half a point less than serum potassium. So that's the first caveat. So there's a difference between serum potassium and plasma potassium. Now, whole blood potassium is where we go ahead and do this technique where we don't spin the blood. And the reason we don't spin it is because if you're worried that you're getting like pseudo hyperkalemia where the cells are breaking apart, usually that's really fast spin is doing it, so we don't spin it. And so that can actually help you to rule out pseudo hyperkalemia. And then the specific question that this person was asking was, what about red blood cell potassium? Why the heck would you want it? The reason you want it is because it's a true measure of the potassium levels inside your cells. And why do you care? Because let's say that a patient has symptoms of low potassium. They're getting weakness or all sorts of symptoms, or God forbid, even arrhythmias going on. And yet you draw out their potassium and it's normal. So you get their serum potassium, and the serum potassium is normal. And so most doctors will be like, well, we don't know why you're having these symptoms, but it's not because of low potassium. Well, it could be because the potassium from inside your cells is shifting out to try to keep the blood potassium or serum potassium level okay, even though your total body potassium is very low. So that's where it is. If you have symptoms of low potassium, but we can't figure it out, we would want to measure your total stores.
Got it. That clears it up. But yeah, I think that's all the questions that we had to address today for potassium. Again, this is a very complex topic, a popular topic. There's so many questions and concerns around it. So we always like to throw out that our email is plantbasedkidneyhealth@gmail.com. For questions that you guys have. And if you're listening to this on podcast, if you guys can, rate and review the podcast, it helps other people to find it more easily. And if you're watching on YouTube, then if you can, like, share, subscribe to the channel. Again, it helps with just, getting our episodes out to more people with kidney disease, at risk of kidney disease, or who have family and friends with kidney disease. So we appreciate you guys tuning in as always. And we will see you all next week.
Thanks, everybody.
Bye.